Welcome everyone to Talking Point seminar series. I'm Victoria Manning, Head of Research and Workforce Development here at Turning Point. Before we get started today, I'd like to acknowledge the Indigenous Australians as the original custodians of the land and pay my respect to elders past, present and emerging. And I also acknowledge the important history, culture, strength, creativity and achievements by Aboriginal and Torres Strait Islander people in Australian culture in the work that we do as we work towards reconciliation. So I will apologise that we had to cancel the previous month's Talking Point at quite late notice. Unfortunately, this was due to some IT issues. But James Gooden, who was due to present that day, will actually do his seminar in July, and that will be on cognitive functioning and what clinicians need to know when working with AOD clients. Today, we're really fortunate to have an excellent speaker, Dr. Sarah Callanan from La Trobe University. She'll be presenting on alcohol consumption during the COVID-19 epidemic in Australia. She's looking at 2 longitudinal studies assessing alcohol consumption in a convenience sample and examining some changes in consumption and harm as the lockdown laws differ between different states. Sarah is a Senior Research Fellow at the Centre for Alcohol Policy Research at La Trobe Uni. She's the Study Director of the Australian arm of the International Alcohol Control Study and the Database Coordinator for a 32-country study of alcohol harm others coordinated with the WHO. Her primary research area of interest is drinking in the home. You're all muted as it's a webinar seminar, so if you do have any questions or comments, please feel free to put them in the chat box and we'll have some time for questions at the end, but I'll hand over now to Sarah.
Hi all, I'd also just like to start off by acknowledging the traditional owners of the land and paying my respect to elders past, present and emerging, and also extend that respect to any Aboriginal or Torres Strait Islander peoples who are listening in today. So yes, I'm talking about shifts in alcohol consumption during the COVID-19 epidemic. Thank you very much, Vic, in Australia. I keep mixing those two up. It's a good start, I'm sure. So there we go. So I've done a couple of presentations on alcohol during COVID-19, and I really struggle on how to present background information because it seems really weird to sort of stand up here and say, so there was this pandemic, I'm not sure if you've heard of it, but I will use this particular figure just taken from The Guardian as a sort of timeline of our year in order to place where we did our surveys. So as I'm assuming most of the people listening are from Australia. Yeah. So as I'm sure you all know, we sort of had the first wave, or as the Victorians like to call it, the easy bit, and then we had the second wave, which was much larger, the larger second wave that was primarily in Victoria. And whilst late last year and early this year, there have been smaller waves and smaller lockdowns in different states, they're not covered by our survey. So we really are just focusing on that first federal wave and that second Victorian wave. So again, this is sort of stuff that a lot of you will know all too well, but so in late March, restrictions were introduced on public gatherings, and then from March 29 until May 16, Australians were only allowed to leave their homes for the 4 reasons. Again, we all know this all too well. And then of course in Victoria, we had the much longer and stricter lockdown for the second wave, and with stricter rules and also of course more cases and unfortunately more deaths. The easing of these restrictions, particularly in Victoria, were very slow, and and it really wasn't until the end of last year that things started to return to COVID normal. It's important to note for this study that bottle shops operated pretty much as usual during the pandemic period. There was still panic buying, especially at the beginning of the first wave when people weren't sure if bottle shops would remain open. You might remember seeing on the news early on, as well as the run on toilet paper and everything else and pasta. We also saw, those pictures of, the lines coming out of Dan Murphy's and, and people really stocking up with trolleys full of alcohol in case they had to make it last for a while. And it was important that bottle shops remained open, particularly for dependent drinkers, but in the end, they didn't really close at all. There were some restrictions placed in WA for a short while, I think, but they seem to be more about maintaining supply rather than restricting harmful drinking. A lot of restaurants and bars delivered alcohol or sold it takeaway to stay afloat during the lockdowns, particularly in the second wave in Victoria. And then just some important information on some of the things that were quite important, sort of contextual information prior to the pandemic. Something that anyone who's worked with me will have heard me say a million times before, but 63% of all alcohol consumed in Australia is drunk in the drinker's own home. So we drink most of our alcohol in our own home anyway. And this is strongly correlated with age. If you're over 55, you're consuming, over 3/4 of your alcohol at home, whilst it's, just over a third for, young people, but that proportion really does increase over time. We also desperately went looking for information on what to expect when all this started about, what might happen to alcohol consumption. And we did find some relevant work, particularly that done on the SARS epidemic earlier on. So in Beijing, people who'd been quarantined for SARS had higher incidence of harmful alcohol use and alcohol abuse than those who weren't. And of course, there's always been a fairly, robust relationship between stress and alcohol consumption. And of course, there was very early on emerging evidence of increased stress during the pandemic, which would surprise no one. There was a Chinese study in the first couple of months of the COVID epidemic that found out that social distancing and lockdown measures did lead to increased stress, particularly in women. And a lot of Australians were reporting worse mental health, at the beginning of the pandemic. So all this came together to mean that we were really expecting to see an increase in harmful consumption. That was sort of when we decided to start measuring and doing our best to measure what was happening. What we were really, expecting to see based on the previous literature was an increase in harmful consumption. So the work I'm presenting here is from 2 studies, and what we really wanted to do was track consumption in individuals over time. But there's some things that are in common about these studies that I'll just address for both of them rather than for each of them twice over. The first thing is we wanted to ask people about their consumption both before the pandemic and then at various points during it. But we recruited people through a convenience sample on Facebook, and we put paid ads on Facebook and Instagram and then offered prizes and incentives to complete. So nothing we're presenting here today is representative of the Australian population. It was much more, it's a convenience sample, but what we're really keen to do as more results come out over time from, say, sales data and more objective measures or representative surveys is see how our convenience sample lined up, and also it was just a way to quickly get some information about what was going on. The inclusion criterion for both studies was simply being an Australian resident aged 18 or over who consumes alcohol at least monthly. We weren't particularly interested in, say, people who might have a glass of champagne at weddings or something. We weren't super interested to hear what was happening with those people. We were interested in more regular drinkers. So the 2 big caveats that sort of go with all of the work we're presenting today is A, it's not representative, and B, the average consumption might be a little higher than you would expect because we don't have those abstainers or more intermittent drinkers bringing down the average. So that's just important to remember as I go through these results today. Our first study was particularly opportunistic. We had something going out in the field that was supposed to go out in the field in late March anyway on drinking motives and stress and alcohol consumption. So we quickly organised for a modification for our ethics and asked to, instead of just presenting the audit and asking people to complete the audit, we asked them to complete the audit based on their 2019 alcohol consumption, and then also based on their consumption at the time of the survey, so that we could kind of get a before and after and get an idea of how individuals' consumption had changed as a result of the pandemic. We had a final sample of 1,684 people who all completed an online survey. Nearly 2/3 of those were female, and that's something I should have mentioned before. One of the things with these online samples is they tend to run quite female, they tend to be a bit old, and they tend to be highly educated. So that's the sort of skew away from the general population that we're usually facing. And we asked respondents to estimate their 2019 consumption in the audit and then also tell us about their experience in the past month. And so the audit test, we had only 8 items, 3 measuring consumption, 3 measuring dependence, and 2 of the harms questions. We had to remove the other 2 harms questions because there were questions about what had happened in the last 12 months, and that obviously didn't work for the timeframes we were presenting. We also gave them the stress subscale from the DAS and some demographic items. This is when we gave the survey, so just towards the end of the first wave, which was good because then people were looking back on their past month. So what we have here are the audit scores from the 2019. So this is actually, I've got before social distancing and during social distancing because at the time this was much more present, much more current. But it was, so 2019 and also during the first wave of the pandemic. The items in blue decreased during the pandemic and the item in red increased, and then the one black item was the one that didn't change at all. So contrary to what we were expecting, it really did look like people were drinking less, or at least drinking less per occasion. And if they were drinking less per occasion, they were risky drinking less, and that sort of seemed to lead to less harm and less of those dependence symptoms in the audit. The only thing that people did increase was their frequency of consumption. So they were drinking more often, but they were drinking less when they did. However, overall, the consumption subscale of the audit still decreased because of the fairly large decreases, particularly in single occasion risky drinking, whilst dependence and the 2 harm items and the total also all decreased. So we wanted to see if these decreases were happening uniformly across the whole group or whether they were happening in certain groups of people. So we ran a regression predicting the COVID audit scores using the 2019 scores, and then we used the residuals from that regression as an outcome so we could see whose consumption shifted positively or negatively as a result of the pandemic. Women decreased their audit scores more than men did. Younger drinkers decreased their consumption and their audit scores more than older drinkers. And participants with high levels of stress were found to decrease their consumption. Sorry, that's wrong. People with low levels of stress were found to decrease their consumption more compared to their high stress counterparts. And I'll show you these with these figures here. So first of all, this is looking at how consumption changed during the pandemic. So if you're at 0, that would mean that your audit score had not changed from 2019 to during the pandemic. And as you can see, it was the younger drinkers who decreased their consumption. So they were the ones who or at least decreased their consumption subscale on the audit. So it was the young people really pushing that decrease that we found, whilst with those aged 26 to 65, I think we cut people who were older, they didn't seem to have that same level of decrease. The decreases were really being pushed by those younger drinkers. This was less true for the dependent subscale, but that trend seemed to kind of be there at least for the women. And overall audit scores, again, it really seemed to move with age, and it was the younger drinkers that were really pushing the decreases that we did find, and it was much less pronounced in the older drinkers. Turning to how stress would, what stress meant in terms of shifts in consumption. In terms of the audit C, those first 3 items of the audit measuring consumption, as you can see, there was a little bit of a relationship there, but it certainly wasn't a strong one, and certainly not as strong as we were expecting to find. But in the dependent subscale, that was where we found that high levels of stress were, people experiencing high levels of stress during the pandemic were actually increasing their consumption in a way that we hadn't seen in any of the other groups that we'd been looking at so far, because overall it had been lots of decreases in most of the groups we were examining. And I think this is really important because a lot of our findings, we sort of did find these sort of minor decreases in consumption, and it really doesn't line up with the experiences of, say, people working in treatment who I think were getting more calls and more requests for help. And we think that one of the reasons that we might be finding this, and that might be the experience, is that what happens in the general population doesn't necessarily really reflect what's happening at the pointy end with the people who might be seeking help. But what we're getting here is a slight picture into the people whose drinking may have been increasing, or at least their dependence like the dependent subscale in the audit was higher, and that is the subscale that's probably most relevant to those seeking treatment. And we were seeing that people experiencing high levels of stress during the pandemic were the ones who'd increased on those dependence items the most. And then finally, there was a bit of a relationship between stress and overall audit scores during the pandemic. So that was our first study. We put it out really quickly, and it wasn't exactly addressing what we wanted to do, but we had an opportunity and we took it. With our second study, we actually wrote the survey specific to COVID. It was the same kind of thing again. It was advertising on Facebook and Instagram and asking people to complete an online survey. We ended up with about 2,400 participants. The mean age was a little bit younger, and the gender split was slightly more even. 43% of people doing the survey identified as male because we've pushed the ads a bit more on the pages of men's Facebooks and Instagram pages, because we were realising what we're up against in terms of recruitment. We asked much more specific questions to COVID in this particular survey. So we asked people about their COVID-19 circumstances. So were you furloughed? Were you working from home? Were you homeschooling? All those kinds of things. We asked the K10 to find out about people's levels of distress, how people were buying their alcohol, some demographic items. And then in terms of alcohol consumption, we asked them the questions twice, again, asking for 2019 and then for the month prior to the survey. And respondents were asked where they consumed their alcohol. So was it at their own home, someone else's home, a licensed premise, or out in public? There's only 4 options there, I know, but those 4 options do account for about 90% of the alcohol consumed in Australia. More if people were consciously sort of putting, social clubs like RSLs and restaurants into that licensed premise category. And we asked people how often they drank in each location, and then how much they drank per usual occasion in that location. So my usual occasion at home in the last couple of months, in the last month, usually involved, say, 3 standard drinks. And so then we could, use total volume to divide respondents up into low risk, risky and high risk based on their 2019 consumption, which I'll get to later. So again, this survey only went out a little bit after the first one. So we were still able, when people were looking back on their past month, they were still looking at a time that covered the first lockdown. And so again, not what we were expecting again, but what we found was a small, not dramatic decrease in consumption. And that was pretty much across the board. The only thing again that stood out, similar to our first survey, was young people. Young people were decreasing their consumption a lot more than any of the other groups. But again, we weren't finding these increases in risky drinking that we were expecting. We were just finding a small decrease. Not particularly significant one either. Basically, it wasn't moving much. In this figure here, we're showing where people are consuming their alcohol in 2019 and during the first during that first wave in May or in April 2020, looking back. So they, again, just to harp on about it, even in 2019, most of the alcohol that people consumed was in their own home. That's where people drink most of their alcohol. But you can also see in 2019, people were drinking in other people's homes, they were drinking on licensed premises, and there was a small amount of drinking in public. Of course, during the pandemic, that changed dramatically, but whilst own home drinking increased, it did not increase enough to compensate for the losses in those other locations. It's also worth noting that we do have we did have some people reporting consumption in places that they weren't allowed to consume. There's 2 reasons for this. 1, sometimes people get surveys wrong, and 2, sometimes people break the rules. So we did have people reporting consumption outside of their home, even when technically that was the only option. Breaking this up a little more so we can see what's happening. What we have here is on the left-hand side of the figure, you can see men's consumption split by age in 2019 and during that first wave. And then on the right-hand side, it's women's. And we'll looking firstly at the men aged 18 to 29 on the far left. What you can see is this was the group that probably drank the lowest proportion of their alcohol in their own home before the pandemic. They were drinking a lot more on licensed premises and in friends' homes and out in public. And so it's no surprise that this was the group that was the most affected by the social distancing and the lockdown, because even though their home drinking did increase quite a bit, it just didn't increase enough to make up for not being able to drink in those other locations. And this is what we think is really driving the big decrease in youth drinking during the pandemic. It's not something to do with youth in particular. It's probably due to the fact that these were the people that drank most out of their home to begin with. All their drinking options have been taken away except for home drinking, and so of course they're the ones who've decreased the most. In all the other groups, you can see that home drinking has increased from 2019 to during that first wave, but not so much that it makes up for the losses, with some, non-significant sort of exceptions, say in the 30 to 49-year-old men. But overall, home drinking increased, but usually not quite enough to make up for those decreases. This figure here stratified people differently. The very lowest row is stratifying people who drank less than 50% of their alcohol outside of their home in 2019. So these were people who were drinking out of the home before the pandemic hit. Then people who were drinking, say, 50 to 90% of their alcohol in their own home, a more usual amount. And then the people who were drinking 90% or more of their alcohol in their own home anyway before the pandemic started. Now, looking at that last group on the right-hand side, you would expect these people to be the ones who didn't decrease their consumption much, because the fact that you can't drink outside of the home really doesn't matter if you never really drank outside of the home anyway. You will note that you might notice that there was a small decrease in and then we also had each of those groups split into low risk, risky and high risk groups based on their 2019 consumption. You'll notice that the high-risk group, even in that group that did drink most of their alcohol at home to start with, did decrease their consumption, but we think that's probably just regression to the mean. If you group people based on any variable in a baseline time point and then measure it again in the later time point, the high group will always sort of regress towards the mean. So we don't think that's actually a real finding there. But if you look on the left-hand side of the figure, you'll see the high-risk drinkers in the group of people that drank less than 50% of their alcohol outside of their home in 2019. These people really did drop their consumption quite a bit. And we think this is important because there's always this idea with policy changes to reduce harms from alcohol and to reduce harmful drinking that often the argument you hear about a lot of policy changes is, the heaviest drinkers, they're the ones who'll find a way around it. It'll only bother the moderate drinkers and the low-risk drinkers, and the heaviest drinkers, they'll always find a way around it. But what we found here is that something's happened to reduce the drinking options that high-risk drinkers had, and because it actually affected the way they drank, they did seem to decrease their consumption quite a bit. I'm not for a second suggesting we don't let people out of their homes to stop harmful drinking, but it is just worth noting that that shifts to the environment can change the drinking of high-risk drinkers in a way that often we tell ourselves that it might not. In terms of the other groups, it does kind of work as you would expect. Again, the idea that the home drinking does increase, but just not enough to make up for the decreases in the other places. And even though we were expecting these big increases in consumption overall, looking back on it, it does kind of make sense. The idea that you don't let people go to other people's homes and you don't let them go to the pubs and you don't let them go anywhere to go have a drink, it does actually kind of make sense that therefore consumption would decrease a bit. In terms of whose consumption was moving in that time, in this particular study, again, we found that compared to the young drinkers, the older drinkers were having more positive shifts in consumption compared to the younger drinkers. Everyone's drinking was dropping a little, but but compared to the younger drinkers who drank the most, it was a positive shift. People who had dependent children increased their consumption more, at least in the bivariate model, as did people who were homeschooling. And this really matched up with narratives we were hearing, in the media and also just frankly from friends and family about the stresses involved in, working from home and looking after dependent children and when they're not able to go to school. And it was a very stressful time. And there was a lot of talk both in the media and, just on Facebook and things like that about people turning to alcohol to deal with this stressful time. However, it didn't come through in the multivariate model as being a predictor of a positive shift in consumption, but the reason for that's probably on this next screen, and it's because we included a measure of general distress. So your level of distress during the pandemic was a very good predictor of a relative positive shift. So the people who really dropped their drinking were the ones who were experiencing low levels of stress, and the people who either didn't drop or didn't drop as much as their low stress counterparts were the people experiencing more stress. Bulk buying alcohol was also a positive predictor, at least compared to those who didn't bulk buy alcohol, which is partially just about intent. If you're planning on getting through the pandemic by drinking a lot, you'd might go out and buy a lot of alcohol at the beginning of a pandemic. But it's just also worth noting that those purchasing practices can influence behaviour down the track. Home delivery of alcohol was not a predictor of increased consumption, but of course the percentage that you drank at home, again, we saw that in the figure before. The less you drank at home to begin with, the more you probably decreased your consumption. And finally, drinking more riskily during the pandemic was a predictor of a downward shift in consumption, but again, that could just be regression to the mean. So I'm now going to present some results from studies that we haven't published yet. It's all very preliminary, things haven't been cleaned, we haven't thought them through, but it's just to give people an idea of what we're finding in this, very interesting space of how COVID's changed our lives. We did do some qualitative interviews with the parents of people, parents of children, people who had who were looking after children during the pandemic, and I've just taken a couple of quotes there. The first one, I would hit about 4 o'clock and my daughter would be going mental. She's been home all day and she's just being a nut job. Then I would start looking forward to a glass of wine, and I would get anxious if I didn't have it in the house. I'd be like, I need to get some wine. Then I would open it at 5 o'clock on the dot usually. And one thing that we are working on now is also, we did ask people if they'd started drinking at an earlier time, and it did seem like the way that people drank did shift during the pandemic. People were willing to start drinking earlier in the day, but again, that doesn't seem to have resulted in increased consumption, although it does seem to have resulted in more frequent consumption. And then I think this last quote's quite important. I think before I used to just drink for fun. I like the taste of alcohol. I like it with food. I enjoy it. I drank for enjoyment. Then there was a point during the COVID-19 where I was like, oh, I need a drink. That was my that's what I thought in my head. I just need a wine. I've had such a bad day. And I think that this quote in particular might be a good way of contextualising our results in terms of how the increased demand for treatment services for alcohol during the pandemic, and we're sort of finding this slight decrease and no one's really drinking as much. And I think one of the other things might be is that there may have been some people, particularly those in that caregiving role and those who were juggling work and children, where they gave up the social drinking, the enjoyable drinking, and instead it was drinking to cope. And that sort of drinking does have a higher link with harmful drinking and seeking treatment down the track. So we're going to be looking through the data to see, how our results and sales data coming out seems to be backing it up, that consumption really hasn't shot up during the pandemic, but and so what's happening given the increased demand for services. Now, in terms of our longitudinal results, back to our little timeline, this is when we administered the 6 waves of our survey. So roughly every 6 weeks, we got back to people to see if they'd be happy to complete another survey, and we just asked them the same questions again to see how consumption was changing over time. As you can see, this is why the Northern Beaches outbreak in Sydney, we're not really talking about that here because we really didn't cover that with our 6 waves. It's really just the Victorian wave and then that first federal, countrywide wave. In terms of attrition, it was pretty bad. We did lose a lot of people after that first survey. A lot of people just straight out said, don't contact us again. And then we got about 70% of those who said they were happy to be recontacted. But obviously, just trying to be really clear about how this data isn't representative of the Australian population. In terms of how it matches, the waves match with the restrictions. That wave 1, which is the one I was showing you the results from before, that was the countrywide restrictions, whilst waves 3, 4, and to a lesser extent 5 covered the Victorian lockdown. Wave 5, things were starting to ease. But I think we were starting to be able to go maybe visit a couple of friends in the 5 or less in the house, but maybe not, and maybe book something in a licensed premise, but the restrictions were still very much in place in wave 5, but just not as strict. All the figures here I'm going to be showing you, instead of showing you how much people were drinking, we're going to show you how it shifted from each individual's 2019 reported consumption, so we don't get caught up too much in the differences between the groups before the time started. As you can see, and as has been consistent through all our results, in terms of who was decreasing their consumption, it really was the young people. And it sort of seemed to really solidly go down throughout the pandemic, with a slight kick up for wave 6, which could be a couple of things. A, it could be the Victorians. You'll see in another graph soon, the Victorians kind of kicked up when they were allowed out again. But also you're sort of getting towards the silly season as well, where consumption tends to increase. But younger people did have that slight decrease as well. It's not like the decrease in the young people is hiding an increase in the older groups, except for sort of a very small one in wave 1 for the middle-aged respondents. We did seem to be getting a decrease there. However, it is worth noting that these were the people we were retaining in a survey, and we kind of worry sometimes that you lose the heavier drinkers over time. In terms of Victoria versus the rest of Australia, Victoria really did seem to drink less during the lockdown waves, so survey 3, 4 and 5. But honestly, we were drinking less before that. So we're going to work out what's happening here. But we certainly did seem to decrease our consumption more than the rest of the country, but that seemed to be happening before the second wave started, although it certainly did continue on with as the lockdowns continued on in Victoria. So in terms of where we were drinking, as you would expect, consumption in your own home did shoot up during that first wave in all across the country, and then in the second wave it started to come down again. Keep in mind, during the second wave you couldn't go into a crowded pub or anything. You could book a table at a pub and eat a meal and have some drinks in a 2-hour slot, but it still wasn't the same kind of thing as being able to go out. And then of course the rest of Australia sort of, as they got to go out, their own home consumption actually decreased a little from 2019, whilst the Victorians' own home consumption sort of stayed higher during the lockdowns and then came down as we were allowed out. In terms of consumption on licensed premises, again, it dropped nearly 100% in the first wave and really stayed down quite low, below 80% of the 2019 levels in Victoria, all the way to wave 5. And then when we were allowed out in wave 6, we kicked up again, and whilst the rest of the country continually sort of increased from the first lockdown, and then there was a little bit of a decrease towards the end. Other home consumption, again, sort of very much what you would expect to find given how restrictions eased in the rest of Australia. So it went down in the first wave and then just shot back up again, whilst Victoria, we kind of got to go out in wave 2 between the 2 lockdowns, and then we were back down again. So it was sort of behaving as you would expect. So overall, consumption has decreased the most in those who drank a higher proportion of their alcohol outside of their own home, particularly young people. But we really think that shift in young people is not about youth per se. It's about the fact that these were the people who drank more outside of their home before the pandemic. Therefore, the restrictions that were placed on us during the pandemic affected their drinking the most. There are indications that some participants are drinking more during the pandemic in response to high levels of stress, particularly in middle-aged adults, but it really wasn't much. Like, those increases were quite small, and certainly not what we would expect to see based on, say, the experiences of treatment services. During the COVID-19 pandemic, Australians may have decreased their harmful drinking, particularly among young adults, but we were drinking more often. We were drinking more frequently, but but overall there was a decrease in harmful drinking, and we're really hopeful that that will be reflected in, say, emergency room presentations and some of those harms, and that hopefully, at the very least, we experienced some less harms from alcohol last year. A potential issue to be aware of, and something that I'm really keen to look up on, is that home drinking is very habitual. So we tend to think a lot more deliberately about how we drink our alcohol. If we go to someone else's house, we'll think about what we're putting in the esky, what we're taking along or whatever. And if we go to a pub or a licensed premise, we'll think about what we're going to buy, and we might think more about how much we're drinking. Whilst drinking at home is something we don't think about as much. It tends to just sort of be part of the routine for a lot of people, and therefore it might be a harder thing to stop doing once you start. So what was happening during the pandemic is people were drinking more often, and they were drinking less on those occasions, but a lot more weekday drinking. And what we're kind of concerned about, and what we're hoping to follow up on, is once people were allowed back to their friends' places and allowed to go back to the pub, did you decrease the home consumption sessions that you were having during COVID, or is it additive? You've gotten used to those weekday sessions now, and you're also going to add on the weekend drinking that you were doing, in more social settings. So that's something we're particularly keen to follow up on over time. And as I sort of mentioned before, one thing we really didn't get was a reflection in sort of this increased requests for treatment and for help with services. And it could be because of sampling. Again, we were just sort of throwing this out to the general population, and sometimes it doesn't capture what's happening at the pointy end. But it also could be, that, like I said, there might have been some of these people who maybe, people might consider a difference between, if you're drinking most of your drinks on a big weekend session or two, or if those drinks are spread out during the week because you kind of need them rather than you're out enjoying yourself, and what kind of difference that has for how people think about their drinking. So I just quickly like to, we put out all these studies very quickly. It was very time intensive. It was a lot of work. So everyone here helped a lot, but in particular, Yvette Mejica-Perez did just a ton of work administering these surveys and keeping the studies ticking along. And she'll actually be doing her PhD. She's the one who's going to be fixing up that longitudinal data, making it, analysing it much more carefully than what I've been able to present to you today. So in the future, if anyone has any questions about COVID-19 and alcohol consumption, Yvette's going to be the person to call. She's going to be the absolute expert in it. If anyone's interested in those first lots of results, just looking at Wave 1 in 2019, we've got 2 papers out that people can see. And that's it. Thank you very much.
Thanks so much, Sarah. That was fascinating. I mean, I guess there's a lot of unexpected findings as well as there were, things that you might hypothesise.
Yeah.
So we've got some questions, but before we get into that, we've had somebody ask if you're going to be sharing your slides, if they'll be available. Is there any
I might need to double check about some of the early results, but I can certainly share the first half, and I can double check about the rest.
Fantastic, and there's the papers there as well. So there were some questions around whether there was any sort of transitioning to other or increase in other types of substance use in those who were decreasing their alcohol use.
We didn't ask. It would have been great to ask because, I think anecdotally there was a lot of chat about cannabis in particular, but we had a lot of arguments about what to include in the survey, and in the end that didn't make the cut.
Yeah, of course. I mean, there were a lot of surveys as well, so you've got to keep it focused, and otherwise people drop out. And we saw that from, I think, the NDARC presentation.
Yeah, especially with the online ones, because all you've got to do is close the browser. It's so easy to stop. So we were really keen to try and keep it as short as we could. Yeah.
You've got fantastic data. Were there any changes in different groups? So those who perhaps identified as non-binary or different cultural backgrounds, did you look at that?
Especially because of our numbers, we were kind of reluctant to look into anything that didn't have a sort of a decent amount of numbers, because we were really worried that sort of 1 or 2 weird results would, end up warping the results and making things look a little bit weird. So we didn't get great numbers. So we decided not to look too carefully into anything that had a small n.
Yeah. And I get this question came through before you presented the sort of longitudinal 6 waves data, but was there any evidence from studies 1 or 2, I guess overall of rebound effects, that people were suddenly sort of out there making up for lost time in that sense?
Yeah, we got it not as bad as we were worried about. We did certainly see a tick up in consumption in Victorians in that wave 6, because that was sort of in December, and I think we were all allowed out again. It was very exciting, but it's also with the attrition and you do usually tend to retain the more moderate drinkers. We're not sure whether that might have been masking a more genuine rebound effect, but we're hoping to revisit our sample in June and find out how people are going, and we're really keen to see long term what it kind of meant for how people drink and where people drink.
Great. I'm just looking at some of the questions that have just come through. Any differences in rural versus city? Did you look at that at all?
We kind of had a quick look, but again, especially in the larger states where we had enough numbers to look for it, it gets so city-centric. But it did seem like, especially during the Victorian lockdown, some of the restrictions were much stricter for Melbourne, and so we certainly did find that the rest of Victoria could sometimes act more like the rest of Australia, with Melbourne behaving quite differently because there probably were more opportunities to socialise and things like that. Yeah.
Yeah, and anything on healthcare workers? Did you look at careers or employment?
We collected it, and I think that's on our list, but we haven't looked at that yet. But the working from home and sort of that divide sort of did seem to make a difference if you had the dependent children at home, but didn't seem to make a huge difference if you didn't. Yeah.
I think we've covered most of the questions. Lots of thank yous, and I echo that. I mean, I think it's really interesting that you're talking about the sort of increase in the frequency in which people were drinking in the home, and there was that fantastic ADF campaign, Don't let a little habit turn into a big problem, which came at such a crucial time.
Yes, yeah.
So I think for many, it would be that sort of differentiating the working day to, what is now their own time, which is, those boundaries are very much blurred when you're in your own home and you're going from perhaps a bedroom into the living space. So
yeah, and I think that when we saw that campaign came out, we just thought that was great because that was really covering the sorts of things that we were starting to worry about. Because we haven't had a chance to look into it really well, but people were drinking earlier, and we already know how habitual home drinking is, and it's much easier to sort of fall into a habit like that, especially in such an unprecedented time, than it is to sort of come out of it. So I thought that campaign was actually great. Yeah,
it was spot on, and I really liked your comments on thinking about the more sort of conscious drinking when you have to get up out your seat and pay for another drink, as opposed to just having one more glass that's sitting in a bottle there. It's just so much easier.
Yeah, and especially if they've become sort of a time of day that you're just used to opening it. You're not actually thinking, should I have a drink right now? It's just, it's time for a drink, and it's a very different way of thinking about it. And there's a good chance that for decades or however long before, that wasn't a time you felt like you needed a drink, and now all of a sudden it becomes one, and the difficulties that can come from that. Yeah,
definitely. Oh, that's great. It's fantastic. Thank you so much.
No worries. Thanks for having me.
And so, in terms of future analyses, you've still got a lot to look at.
Yes.
And will you revisit? Will you go back to the sample perhaps a year on to see longer term changes?
We're hoping to go back in June, and in theory, fingers crossed, that's because everything's been really normal for a while. I really want to knock on something having said that. But yes, to see exactly that idea of, say, has home drinking decreased, and, especially if, and having a look at maybe people who experienced high levels of stress during the pandemic who are no longer experiencing those levels of stress, and, what that meant for consumption overall and things like that. So we're really excited.
Oh, look forward to seeing that.
Yeah, it'll be good.
Fantastic. Thanks so much. Well, we'll bring it to a close today. The next talking point is in May. I'm just looking for the date. I think it's the 16th, I believe. 1 second. The 19th, May the 19th. And that will be Dr. Jessie Young, who's talking about dual diagnosis, so mental health and substance use as an underappreciated determinant of health disparities. So please join us for that one. And thanks along for coming today. And thank you, Sarah.
Thanks.